Welcome back, Raw Thoughts listeners, to another episode. Today, I have two individuals that get to come onto the podcast. That is pretty rare, but it's always super fun to see the dynamic and how they are correlated with each other and what kind of conversations we can have on here. Raw Thoughts Podcast is an open podcast where I invite people on and just really hear about their stories, wherever they are in life, what they've gone through, and where they're headed. So if you would like to be on the podcast, I encourage you to reach out to me on social media. You can reach out to me on my website, rawthoughtspodcast.com, along with my email, m.rawthoughts@gmail.com. So further ado, we have Craig and Eliza. I know it. I think it's maybe, I'm going to say this, a male name and you're a female. So it's a little bit, I haven't ever heard that name for a
Eliza.
female. Eliza.
It's like some people nickname for Elizabeth.
Gotcha.
My full name is Eliza.
Eliza. Okay.
Yeah,
Welcome, guys, to Raw Thoughts.
Thank you.
Thank
We're
you.
so grateful to be here.
Yes. Okay. So tell us who you are, where you are, what's about you guys.
Sure. So I'm Craig Clayton. Or Dr. Craig Clayton. We opened Restoration Dentistry Art and Wellness in November. So it's pretty new.
Yeah.
We are very excited to be open and serving the community of Meridian, Idaho.
Yes. And husband and wife duo.
Yes.
Mm-hmm.
And what do you do within the your guys' kind of business?
So at first I was just picking up any sort of job that he needed help with, but then it turned into doing all the marketing for the office, which I was a little surprised by, and I'm learning as I go, but I'm having a lot of fun with it.
That's cool. What did you do before this?
So I studied child development, and I have 2 kids, and I was home with them full time, taught a little dance on the side. I grew up dancing. So I didn't have intentions to do this, but it's been a good fit and definitely a big need, feeling a lot of purpose, helping out.
That's awesome. And that's actually how you had reached out to me, hearing from Dr. Cutting, actually, kind of within everything, and then, reaching out. And so the social media and, before we were recording, Clayton and I were talking about like how much social media can really influence people in a positive aspect. And what's kind of your history with that?
Yeah, Instagram is really powerful. We first started discovering the power of Instagram when Eliza was pregnant with, I think, Henry, and then really dove down into the Instagram birth world when she was pregnant with Oliver. And I'll let her talk a little bit more about that, because then that ties into my own journey.
Yeah.
Yeah, I was researching about all the different ways to prepare for birth and happened upon some accounts that helped me immensely prepare mentally and emotionally for both of my children. My second ended up being a home birth.
Awesome.
It was a really incredible experience, and I'm really lucky I got to experience that. So all of that was learned originally through Instagram, led me to other books and podcasts and things. So I was just completely caught off guard that my life would be so affected by content I found on Instagram.
That's awesome. And it's cool to actually hear stories where it does impact you, because as I'm going to say influencers, you're like, why am I doing this? Or what am I putting this out there for? Even continuing, the consistency of posting for the podcast, it can get really mundane and down. But then you hear stories where you really were impacted by it and it was a need for what their content was.
Yeah. I'm really grateful.
That's awesome. And so how did that tie into your journey?
Yeah, so I saw the power of Instagram in Eliza's life, and then she would send me content over, and we'd go through content, and she's very knowledgeable in the world of birth, and so I can speak for her when she says that pursuing a career of some sorts in the birth world is something that she would like to do after all this marketing, and once things calm down a little bit and the business is humming along. She's very passionate about it, and so am I. I like to joke that in my second life, I may have chosen to be a midwife.
Awesome.
Because experiencing birth those were the 2 single greatest moments in my life, the birth of our 2 boys. It's something miraculous and something that can be such a good experience, but in the media it's portrayed as something painful, undesirable, a medical procedure, something that women just have to grit their teeth and bear, versus watching Eliza and her experience. It was something beautiful and something that she looks back on with a positive energy. And so that was powerful to see how through Instagram we could learn that information and learn things that we were never exposed to before as children or adults. And so then with that knowledge and that experience, I started looking into dental accounts on Instagram. And people may think that's pretty boring, but it's fascinating. The world of dentistry has really opened up to me. And there's a lot of just top class clinicians all over the world that are on Instagram and that post their failures as well as their successes. And they obviously post a lot more successes, but they are very transparent. And what's so amazing about that dental community on Instagram is that many of them are responsive. You know, I've messaged with people in the UK, in Saudi Arabia, in Arizona, and they respond, and they're willing to help you out no matter what their what their level is of really popularity or prestige. You know, some of them are very world renowned and they respond. And so I was very impressed by that. And really, I have Instagram to thank for the trajectory my career has taken.
That's awesome.
Because, I mean, if we want to get into it now, something
absolutely.
people ask me all the time is, why dentistry?
Yeah.
The other day I work in the prison on Mondays to supplement income while we're growing this practice. And I was riding the elevator down with two nurses, and they both asked me, why dentistry? Like, I could never work in people's mouths. It's just disgusting.
I would never be able to do it.
Right? And it really baffles people why I chose the profession. And it's honestly pretty uninspiring why. I was 21. I took one business class and thought, not for me. And I had no really interest in pursuing. In high school, I was not a good student. I didn't have passions. I didn't have pursuits. I got a really lousy, I graduated with a really lousy GPA and just happened to get into a college and enrolled because that's what everybody was doing.
Right.
So I had friends that went to Ivy League schools, and then I went to just a small little school and didn't understand what to look for in a career. And I was sitting in a dental office at the age of 21 and waiting to go in for a cleaning. And I had this thought, maybe you should look into dentistry. And I had never, ever considered it before as an option. And the more I thought about it, it checked a lot of boxes. I love to work with my hands. From a young age, I spent a lot of hours by myself building with my hands, building with Legos and Kinects and brainstorming and dreaming about things that I could create. But didn't enjoy the math, so I wrote off engineering. And so dentistry checked a lot of those boxes. I wanted to be my own boss. I wanted to be home with my family as much as possible, so I wanted control over my schedule. I liked sciences and biology and studying about the human body, and I like working with my hands. So dentistry really fits the bill pretty well. So I pursued that path, and in college, turned my my habits around as far as pursuing education, studying. I learned how to learn, and realized for the first time in my life, I'm actually not dumb. I can apply myself and get things done.
Yeah.
Whereas previously, I just wrote it off as I'm just not very smart.
Right. You didn't have those habits or really that like connection of wanting to learn, but it sounds like dentistry was like you had a thrill in wanting to learn this topic.
Yes. And in undergraduate, honestly, I didn't really have an idea of what dentistry would look like. I just had this picture in my head of what my life could look like, and then dentistry would help provide that life. But through my undergraduate degree, I really enjoyed it. I loved learning about. I graduated with a degree in exercise science, so I got to study athletic training, physiology, pathophysiology, anatomy, different biologies and nutrition, and loved it. Just couldn't get enough of those classes. But at the end of that, and did a lot of cool things. Worked in a research lab, did a lot of dissecting and research with human specimens to help progress the field that way. But it wasn't until the end of my senior year that I realized, I didn't explore other options. I was so myopic on, I'm doing dentistry. I have to check all these boxes and complete these courses and get good grades, that in my final year of undergraduate, I realized, oh boy, I didn't look at physical therapy. I didn't consider athletic training. I didn't consider other medical professions. And I kind of freaked out a little bit.
He was panicking.
Yeah. So when did you come into this journey?
His senior years, the first year we were married.
Okay. And so when you had that thought, what did you do? I mean, you had that panic of like, I've just came this whole way. I'm just kind of forging forward to dentistry, but yet I could have had something different that still checked all those same boxes.
Yeah, at that point in time, I had 3 interview invitations at 3 different dental schools. And then I got into all three of those dental schools. And I froze. Like, well, I've just spent 4 years, actually 5 years getting here. I have 3 acceptances, which is not common to have the choice of 3 different schools. And I thought, okay, well, this is where I've been going, so I'm just going to keep going on this path. Again, not super inspiring. I just felt compelled to keep moving forward.
And I think sometimes we don't have to feel inspired. You just have to continue to keep going forward instead of that freak out mode and pausing and holding and then not doing anything at all.
Sure.
So how did you make the choice? You had 3 different schools to go to. How did you make that choice?
I went out and visited each one and interviewed at each one. And I wanted to choose a place that would be great for our family to live. So we chose University of Kentucky over Creighton and the Ohio State University, as they like to call it.
Wow.
You can't forget the.
Yeah.
And it just felt like the best place to live. And we really enjoyed our time there. But I learned a lot of good lessons in dental school. It's extremely demanding. It's one of my semesters there, I had 44 credit hours in one semester.
Wow.
So it's intense.
Yeah.
Dental school's no joke.
Right.
And I learned a lot there because I was, in a pressure pot.
Right.
And it broke me. And so end of first year, I again freaked out and thought, I can't do this. I'm struggling with a lot of things outside of dental school that are super weighty. And there was a lot of stuff going on with my personal family and my extended family that was really heavy. And at the end of first year, I just thought, I don't know if this is worth it anymore. I'm going to cut my losses now and quit and go pursue another career. Because I learned in dental school that passion drives me. And if I don't feel passion towards something, I'm not interested.
Yeah.
And I wasn't feeling the passion. It just felt like a grind. I can't tell you how many days and how many months I just felt this black cloud. And I refused to use the elevator in dental school. I was always kind of an exercise nut. And so I'd climb the stairs, the 6 flights of stairs up and down all day long. And I remember feeling this immense weight and darkness for so long. And that played into the thought, I don't want to continue with this.
Yeah.
It's not serving me. It doesn't feel right. So that was a hard time in life.
Yeah. I mean, it sounds like it. You have what I'm going to assume you now have her where you're making those decisions. You have your external family. You have all these other variables besides just school, right? Like you have so many other things happening that make an impact on what your choice is going to be.
Yeah. And at that time, I was pregnant with our first, and my pregnancies are awful.
Okay.
And I was extremely sick. And so that was pretty heavy on him as well to watch me so sick.
Yeah, you're sick at home trying to have it, grow a baby. You're trying to go to school. You have all this friction. So what was that next step of, do I continue in this black cloud and kind of forge forward with this grit and know that there's going to be something, or do you pivot and make a different choice? What was that dialogue like?
It was a hard one. It was a really hard one, and it struggled with it for months and months and months. I love to be outdoors, so I dreamt of pursuing a career outdoors. I didn't know what that looked like. But at that point in time, dental school is not not inexpensive. It's very expensive.
Very expensive.
So at that point in time, I was now into my second year, into the second semester. And so that meant I had, at that point, had about $200,000
Wow.
of student loans. So I thought, what can I possibly do to be able to pay that off with an outdoor, some sort of outdoor job, whether it was being a park ranger or search and rescue or firefighting or, creating some kind of outdoor experience to offer people. It just seemed unreasonable as far as taking care of a family. So I hunkered down and thought, I just need to get through dental school. I'll get it paid off, and then I'll pivot if I want to. And it was podcasts that really started to open up a window of hope for me. I went to a dental conference in Kentucky, and there were speakers there like Mark Costas, and he's a prolific podcaster in the dental world. And he was really inspiring. His story was inspiring. And so I started digging in and listening to podcasts. And I rode my bike to and from school every day, year round.
For 4 years.
Wow.
In the winter, in the sleet.
The only time I didn't ride is if it was icy.
Wow.
And I rode once when it was icy and ended up sliding down the road in traffic.
Oh my gosh.
And luckily the car behind me could stop.
And let me clarify, I wanted to give him a ride, and he said no.
Oh my gosh. Was this just because you needed your body you needed your body
I
continue
needed
to
that.
move? Yeah.
I needed that, at the beginning and end of the day.
Yeah.
So exercise plays a big part into my mental well-being.
Yeah.
So I needed that. And I rode over 10,000 miles over those 4 years.
Wow.
And those podcasts, I just started plugging in podcasts to and from and listened to hundreds and hundreds of hours of podcasts. And that gave me, again, hope that I could understand how to run a business and set myself free, if you will.
Yeah.
And so I pushed forward with that. But again, once I got into private practice and passed school, and I graduated during COVID, so almost 3 years ago, and I got out into private practice and again, just felt bogged down. Like I don't really like what dentistry looks like.
Mm-hmm.
It's really fast. I don't get much time with patients. I'm rushed through procedures. I have to produce. And I felt very disenchanted with dentistry and started losing that light again. And it was Instagram that then again changed that.
Wow.
And brought that around 180 degrees as I started finding these clinicians on Instagram that just produce beautiful work. I thought that looks satisfying. If I can get there and focus on delivering that kind of quality, and as well as they spent time with their patients and they spent time, because being able to produce amazing work in dentistry takes a long time.
Yeah.
And that started to light a fire under me again.
With I'm going to say producing these things within dentistry, what kind of things are you producing, or the procedures that you are doing that do take time and that really kind of, light your fire for you that you want to do within dentistry? Because I think just thinking about it, right, I think of dentistry as getting your teeth cleaned, the braces, putting the crowns and the, filling your cavities. Like those are the things, but I know that there's so much more within dentistry. What are those procedures that you're specifically talking about that you want to produce?
I love that question. And my mind has just opened up this whole umbrella of all these different things that I feel like I need to talk about to explain it. When you think about the oral cavity, it's a very harsh environment. It's repeatedly acidic. It's wet. It's dark. You chew things. There's a lot of force generated. It's a really hard place to work in, and we're measuring in tenths of millimeters and millimeters. So we're working in very, very small places, trying to fix human tissue with man-made materials. And so, I love your question because dentistry from an outside perspective feels very much like a commodity, right? All the things you listed, like I go to the dentist because I need a filling, or I need braces or want braces, or I need a cleaning. And so it's very commodity driven. That's the way the profession has gone. It's separated from the medical field for some reason. And so dentists are thought less of physicians of the mouth and more of technicians. I need a cleaning. I'll call my dentist or call a dentist and say, hey, I need a cleaning. And then they get me scheduled and I get a cleaning. And I like to use the example and to illustrate this disconnect. Say you were to go to a pharmacy and take your blood pressure, see your blood pressure's high, and then call a primary care physician and just demand, I need some blood pressure medication. I took my blood pressure. It's a little high. Can you just call me in some blood pressure medication? It doesn't work like that.
Right.
And this is all background to kind of get to where your question is going. And so taking back our profession is something I'm passionate about. And our profession has gone the way it has for many different reasons, but understanding that we are the experts of the oral cavity, we need to be screening for oral cancer. We need to present the solutions to diseases. People should not get cavities. That is a disease. That is not normal. And people that continue to get cavities, that disease is not being treated. The symptoms of the disease are being treated. You're getting fillings, you're getting crowns, you're losing teeth. That is something that can be prevented. Same with gum disease. It's something that treated with cleanings and with other therapies, but a lot of times it's not actually addressed to change the factors that are causing that. And so I'm very passionate about a holistic approach to dentistry. And I've learned that that's kind of a buzzword. When people hear holistic, they think alternative medicine and naturopathic medicine, which is great. And there's a lot of great alternative medicines. But when I say holistic in my practice or in the dental field at large, it means evaluating a patient as a whole person. It's not just looking at teeth or signs of disease. It's looking at mental factors, social factors, other risk factors, other health conditions, and getting a full idea of who this person is and what could be playing into their oral conditions before we pick up the handpiece or the drill, as people will call it, and start fixing things. Like, we have to slow down. And so that is something I'm excited to offer my patients and hopefully help other colleagues understand as well, to slow down and figure out what's going on, what's causing issues, spend time getting to know patients before you focus on the production. And when it comes to the production's fun. Yeah. I'm talking a lot.
No, that's what you're here for on the podcast. You're here to talk.
You got me going, and I'm very, very, I get shaky because I get so passionate about this.
I was gonna say, you can see yourself light up, and that part is really cool to watch. Like, so don't feel like you're talking too much. That's what you have listeners hearing this, and this is really cool.
I feel like it's so refreshing, or I hope it's refreshing for other people to hear this side from a clinician. Because dentistry is really an art, and it's a science, and it's part of the medical profession. And so one reason I feel like dentistry is becoming so commodity driven is the way payment is structured. It's very insurance driven. And what insurance does, what a lot of people don't understand, is as a dentist, we set our fees and the fees are not just arbitrary numbers. Oh, this is what I need to be able to make to, buy some fancy house or something. It's a very reasonable fee that is set to be able to cover our overhead.
Right.
Dentistry has a very high overhead, 80%. Some dentists practice at 80%. If you're at 60%, you are doing really well. You are in the 95th percentile of dental practices. But what insurance does is I say, okay, these are my fees. This is what I need to charge my patients to be able to pay all my team, pay off my loans, pay my materials, pay my lease, pay technology, pay for CE to stay on top of things and and become the best clinician I can be. And then insurance says, oh, great. we'll pay you 30% less, 40% less for your work. So they undervalue us, and then that trickles down to the patient because the bills haven't changed, the numbers haven't changed, but what has changed is the need to do more dentistry. And because the dental profession has to do more dentistry to be able to just meet their needs, that translates to less time with patients and more rush procedures. And that's not at all saying that dentists are haphazardly doing dentistry, but what suffers is they don't get to spend the time that they may like to spend getting to know a patient on day one,
Right.
or spend in a procedure, or slow down a little bit and not work so hard, because working in a traditional insurance-driven practice is exhausting. You run from chair to chair all day long. Exams in between your own treatment. You go numb here. You go do 2 exams, and then you go back and do your treatment. Then you get interrupted again. Then you have an emergency patient, and it's just nonstop. And it feels very technical. You're providing a lot of technical services and not a lot of holistic care. Like, let's figure out what's going on here and help you get to your best place and talk with physicians and get you referred over to people like a chiropractor or a physical therapist or a primary care physician or a cardiologist. There's a lot of things we see in dentistry that are red flags that this patient has other needs besides what they're here for or what they want.
The other thing too, I mean, just what you're describing is that the longevity of you being able to take care of yourself, taking care of people like that, is just minimizing, right? Like your time, the amount of effort and going from here to there, not only physically demanding, but mentally demanding. And you're just, all right, next one, like done. And you're not spending that quality time with the individual to really kind of dig deeper of not only how can we help you prevent these things, and I think that is where sometimes within the modern medicine that it can feel like we're not preventing these things, because then that doesn't mean they come back in. And if they don't come back in, that doesn't mean we get a paycheck. And, all of these things are trickling down. One of, I had actually seen on one of your guys' social media post of how many different diseases that you can see within the mouth. What is that number? It was like astronomical, I felt like.
Yeah, so there's a clear connection between the oral environment and the body systems at large. There's 57 diseases connected to inflammation in the oral cavity. The most established are Alzheimer's, diabetes, heart disease, atherosclerosis, and then the complications from that, like strokes and heart attacks. Those are all very well established and connected to the oral cavity. Inflammation is the common underlying, as I'm sure you know as a paramedic, inflammation is the common underlying factor in so many different diseases.
Right.
People develop, get coronary heart disease or atherosclerosis because of inflammatory factors. People get Alzheimer's because of inflammatory factors. And most of the population is walking around with oral inflammation, which means these inflammatory factors are coursing through their blood veins every single day. But because it doesn't hurt them, it's not a threat.
Yeah.
And
I think too, because it's not this big red flashing sign, right? Of like, this is going to make you die one day. They don't have these, big alarms going off because I'm going to take some ibuprofen or aspirin and I'm going to bring my inflammation down. And, that's a quick fix to it, but that's not the answer to it.
Mm-hmm. Correct. In dentistry, most people think, and I say most from experience, most people think that they don't have a problem if they're not having pain. But I have to tell patients routinely, once you start having pain, things have gone way too far. Yeah. When you start having pain in your tooth, it's most likely you need a root canal treatment. That's pretty aggressive. Once you start having pain in your gums, it's because you've probably had bone loss and an abscess in your gum tissue. That's way too far. So helping people understand and appreciate the value of consistent oral health care. It's not something that you just get, call for when, I haven't had a cleaning in a while. I should probably get a cleaning. Or, people typically call when a tooth is hurting, they've broken a tooth, for cosmetic concerns, or because they just haven't gotten to cleaning in a while and think, oh, I miss how my teeth feel when they're nice and clean.
Yeah. How often do you recommend just going in and doing a cleaning and a checkup to help prevent those things, or for you to be able to see these markers and telling them, hey, like, I'm seeing this inflammation. This is what we should start looking into?
At first, every 6 months. And that's what I learned. That's what I love about my practice model. It's very, because I'm not so worried about insurance and when they will pay and what they will pay. I get to customize. Some patients come in and they don't have a lot going on. They don't have inflammation. They're not a high risk for getting cavities. All their bone looks good. Their tissue looks good. I may tell that person, I only need to see you every 18 to 24 months. You're doing great. Just
Awesome.
keep up doing what you're doing. But at first, I would say every 6 months, because 99 out of 100 people have inflammation of some degree, and we have to get that under control. There's too many risk factors related to that. So at first, I'd say 6 months, because that allows me to establish a baseline. I do things like salivary testing to get back a bacterial profile, to look at the bad bacteria that causes oral disease and see where they stand. And then I can use different therapies to then control those, get those down, and then retest later to make sure we're successful.
Awesome. And you have, before we started recording, you have gone from the private practice to working for somebody else. You've done all of these things. Tell us a little bit about those different places you worked and how your practice is different now that you've actually got to build from the ground up.
Yeah, this has been fun. I've been dreaming about building a practice for years, and I've thought through every detail in my practice is very intentional. It's not something that I threw together. So I started coming into the private practice world, working for a doctor in 3 different practices, and it was a great opportunity. And I also worked in a corporate setting at a big
Chain, if you
at a
will.
big chain, dental chain called Aspen Dental.
Okay.
And they've got over 1,000 locations all across the country. And so those two were very contrasted. Aspen was extremely production driven. The more you produce, the more they expect you to produce. They control the schedule. They, as in people in a corporate setting, like they're not even clinicians, and they're the ones dictating what the doctors have to do and how much time they get for their treatments and how much they have to produce.
Wow.
So you can guess how that affects.
It's numbers driven at that point.
They don't care about recare. All they care about is production that day. They could care less if someone comes back for normal hygiene. As long as they've made their money from a big procedure, big surgeries, dentures, then it doesn't matter if they don't come back. So patients are walking out the back door as soon as, as fast as they're coming in. And that just did not sit well with me. The other setting was a small DSO, you'd call it, so a dental service organization. So a group of 4 practices owned by 2 doctors, and they were great to work for. However, I still missed that ability to be able to customize my experience, because at the end of the day, if I didn't produce enough, or if I didn't do things quite right, I'd get a phone call and have to have a discussion on what to do differently or better. And then my favorite practice I worked for was just a single doctor owner. And that was a dream. I loved working there. And that was a practice in Nampa. And I would be happy to say it's Dr. Stuckey's practice.
Awesome.
And he was just a dream to work for. His whole team there, their approach, even being an insurance-driven practice, there was just a different feel there, as far as the energy in a practice that was owned by just one doctor.
Right.
And then now I work in the prison part-time, and that's a totally different environment. So I've worked in 6 different settings, as far as 4 different private practices, a corporate office, and now the prison. So I've seen a lot, and that has played into the experience that I've created.
Yeah. And you've talked about, kind of the insurance models with these other, practices. What is your guys' structure like?
Yeah. So we work with all insurances, and we say we accept all insurances. Where we're different is we don't let insurance dictate how we do things. So when a new patient comes in, I schedule them for 90 minutes. No cleanings. That's just an exam and time with the doctor. And so that 90 minutes is taken to, or is used to get to know the patient. They come in, we get to know their personal history. We get to know what they like, what kind of music they prefer, where they like to vacation, what are their dogs' names, what are their kids' names, what are their hobbies. We really get to know them as a person. And then from there, from that broad setting, then start to go to medical history and dental history and start to narrow in on the dental related aspect for why they're there. But that 90 minutes is so important to get to know who we're treating and what we need to treat to then be able to start to customize their treatment needs. So I can't imagine practicing any other way. And the reason why we're not contracted or preferred providers, which preferred is just a made up word by dental insurance companies. It doesn't necessarily mean that we have vetted, that the insurance company has vetted all the best dentists in the whole area, and these are the very best you should go to. No, they're just the dentists that have signed up and contracted with them, and it's nice fancy terminology.
Gotcha.
And so insurance will reimburse you a certain amount for what you do. So on my end, what we do is we still work with that insurance, but the patients pay for their treatment up front, and then we communicate with the insurance company to get their reimbursement. And they actually end up reimbursing more than they would if they were going to a doctor in a typical insurance setting, which is kind of the weird thing about insurance. But what that does is it allows us to be able to spend more time, because a couple dollars more per procedure, and talking about a business here, translates into being able to give more.
Right.
You get a much different experience going to a McDonald's versus going to a nice sit-down restaurant, and you have to pay more. But what experience do you want? Do you want the best treatment? Do you want the best food? Do you want the best customer service? Or do you want something that's just very quick, consistent? It's okay. And so that is something that is now spilling over into, I think, the healthcare industry at large of I want the best treatment. I want to be seen and cared for, especially because, and I'm going a lot of, if you want to ask a question
You're
and slow
good.
me down.
No, you're good.
But, something we talked about coming in is dental anxiety. So many people have dental anxiety. I can't tell you how many times I've heard in my couple of years in private practice, "Oh, I hate the dentist. I hate the dentist."
It's a big, scary place.
It's a big, scary place, and it's interesting. Dentistry is usually in the top 10 most rewarding careers.
Wow.
So the U.S. News comes out with some report, right, every year. Here's the top 10, top 20 most rewarding careers to get into. But dentistry is also one of the highest, has one of the highest suicide rates for dental providers, because they're dealing with anxious patients and they hear all the time, "I hate you. I hate you. I hate coming here. This is the worst place. This is terrible." And so you compound that with working really hard, running from place to place, hearing how much you're disliked and how scary it is to be there. And it translates into, at times very negative health impact
Well, and
for
I
the
think
provider.
absolutely. And I think when people have those anxieties, it's not necessarily about you, it's the label that you have on yourself that then they
Exactly.
correlate those two things with what you do, I don't like. And so therefore I don't like you, being the provider. What are some of the things that you do within your practice to help relieve that anxiety?
The number one is that 90-minute appointment. Traditionally, I'd get 10, 15 minutes maybe to talk with patients, and that's already after they've already had someone work in their mouth and be in that personal space. And then I get a couple minutes to talk with them and tell them everything that they've got going on and try to diagnose what they need before they leave. So that 90 minutes, we really get to know them. I want to hear about their dental trauma. I want to hear about what scares them. And I want to learn what relieves their anxiety. So that's the first start is where they're at. It's really amazing how I can work with the most anxious of patients And because I take the time to get to know them as a person, they trust me a whole lot more. They trust me to get them numb. They trust me to do treatment. Whereas previously they'd be a wreck and they just not show up to their appointment. So building that trust. And then on top of that, we have private treatment rooms. So when you walk in the office, you don't hear suction. You don't hear the handpiece. You don't hear any of those dental noises. It's quiet. It's serene. It doesn't smell like a dental office. It sure doesn't look like a dental office.
Yeah,
it's a beautiful space.
I was gonna say, I've seen some of those, just videos that you guys have posted, and I think that really has helped my side of just getting to kind of do a walkthrough of your place, because it doesn't look like a dental office. If I was to just walk into those doors, there would be no correlation to this is where I'm going to get my teeth cleaned, or this is where, I'm going to get my oral health taken care of.
Yeah, and every single aspect of that, every single detail of that practice has been well thought out, and everything's been designed to reduce anxiety. The high ceilings, natural light in every room, the serene, the pictures and paintings of landscape, the plants, the smells, the light colors, everything was designed from a psychological aspect to, reduce anxiety. And then when they get into the treatment room, when they look around, all the dental equipment's behind them. So when they look around, they're in a nice, comfortable, warm, brown leather treatment chair. And when they look around, there's a painting, there's natural light coming in through the window. There's no dental instruments. There's no overhead light or x-ray tubes. And then we provide weighted blankets, heated blankets, regular net blankets, steam towels, noise canceling headphones, entertainment, nitrous, oral sedation, just all sorts of different modalities to help then treat anxiety. And then the biggest thing is just slowing down. Most patients do really well if I just slow down and talk to them about the procedure and what's happening, and then they do okay.
Yeah. I was gonna say, I think a lot of, the anxiety with people in these situations is they don't know what is actually happening. And so then when they don't know what's happening, their brain just comes up with their own story, and then they start spiraling. And this is my experience from, being a paramedic, where when they don't know what's happening, they come up with their own dialogue. And I love the fact that you have such this psychological approach to your office, where walking in, you're already in a calm state. There's not things that are heightening you. Maybe somebody walking in, they already have that history of the dentist and the trauma, but you're already trying to, lower that by them coming into your office. What have you seen as the wife of him through this whole process? I think you guys seem to have these dialogues and these conversations and these inputs with the whole office. Like, what is your take on this?
Well, Craig processes by teaching. So since dental school, he would come home and teach me what he was learning. And sometimes it was just way over my head, but I would just nod and listen. And it just continued when he would listen to his business podcasts about how to run a dental practice in school. He was reiterating all of that to me. And then again, when he started learning about biomimetic dentistry and the whole wellness dentistry, he was teaching me, and I was just absorbing it all and going, wow, as a regular person who doesn't have a dental background, like this is immensely important. We need people to understand there's a better option. And so I became just equally as passionate as him in getting his message across. We've come up with 6 pillars to kind of explain how we're different and what we can offer to people. And I'm just really excited that people can have a new, better experience at the dentist, and hopefully just alleviate that anxiety, give them better long-term results, and really take care of the whole person.
That's awesome. What are those 6 pillars that you guys have?
So, do you want to say them?
Oh, go for it. I've been talking a lot, so
yeah,
you take a turn.
It's my turn. So the first 2 are in our name. So we're Restoration Dentistry, Art and Wellness. So art is talking about the artistic aspects of dentistry, all the different colors and textures that he can bring into teeth. Oh, sorry, I need to talk this
You're
direction. Good. And then wellness is, again, talking about that whole wellness dentistry and treating the whole person and making sure we're addressing all the different sides of that person, the emotional, social, mental factors. And then the next two would be technology. He's invested heavily in the best technology, and that's to aid in giving the patient the very best experience and best care. And then there is biomimetic dentistry, which is a method of dentistry. Craig hasn't gone into it yet, but I hope he will, because this is fascinating, absolutely fascinating. Tell them about the eggs in a minute. And the last two are comfort. So that's talking about dental anxiety. So all the office comforts we offer, and then community. So our focus on our community and becoming a restoration dentistry family where people feel part of a community and lifting up other small businesses in the area and making sure we all are taking care of each other and also the environment.
That's awesome. Okay, I'm curious about these eggs.
All right. So one of our most popular videos on Instagram, and we're still building a following, and Eliza's done just an amazing job doing all that social media. Our marketing company that I've hired to do all the SEO and Google ads and all a bunch of other marketing stuff has been super impressed by what Eliza has done. So
she's done amazing.
She's done amazing. Yeah. People ask her all the time if she has a background in marketing. Like, nope, she just has good ideas, and she knows. She's very driven. She's extremely intelligent. She's way more intelligent than I am.
No.
Yeah, much more. She really is.
We do have different brains. You're the sciencey brain, and I'm the social brain. So
yeah, she
does.
And
he's very gifted socially, but I think the Instagram comes to me naturally because I just love making connections with people, and I like making visually interesting things. I'm a dancer, so I think just putting those two things together, it's been a lot of fun.
Well, and I think you have the technical part, right? But you have the connection part. Like, you wouldn't be able to do both of those things. And so not only having a partner, a spouse, your person being able to help, really take those passionate pieces that you have the knowledge for, but she's able to push those out and get you those people. You wouldn't have the time or the space to be able to do that because you need to be able to do your job, right? You need to be able to do your continuing education and learning all of the new modalities that you can do within dentistry. And so just having you guys both in the same room, and what I have seen personally on your social media, it is very comforting knowing that you haven't hired just somebody that, is just going to push things out because you're pushing your business out. She has the same passion for what you're doing, just in a different aspect. Yeah. And really, I think that's where you guys come together and truly are a team in lifting each other up, which is super awesome to see within a couple. Not only within a couple, but also a couple that works together. Before you kind of go into that egg, I want to ask, how is it? You are working in the office, you are doing these social medias, then you go home. What is that dynamic within your marriage too?
It's been challenging.
It's brand new too. So
yeah.
he started working on the practice full time at home in September, end of August. And then the practice opened mid-November. We started seeing patients in December. And so this is all brand new. So we're no experts.
And you know what? It's kind of fun that you're right in the middle of it.
This is brand new. It's very exciting. I will say the one thing we're really trying to work on is work boundaries, because it's very easy to talk about it all the time, not only because it's what needs to be done, but because we're both passionate about it. And we love talking about it. But then we have to say, okay, pause. It's 8 p.m. Let's switch.
Let's go watch Glee.
Yeah. That's awesome.
Yeah, we need some humor in our life right now.
Oh. And how about is it 2 boys that you have?
Yes.
And how is that mixed with all of this?
It's overwhelming.
You're like, my hand is raised. It's overwhelming.
It's overwhelming.
So how do you deal with that overwhelming aspect?
One day at a time. There's no secret to it. I'll be perfectly transparent here. I'm really struggling with it. It's hard. Especially our 3-year-old has been just insanely challenging. So it's been, he's been up a lot of, hours during the night now, won't go to bed until late at night. He went from being our, go to sleep at 7, wake up at 9 kid to waking up all night long, having awful rage tantrums, not going to bed until late. And so, it's been overwhelming.
Yeah, not good timing, unfortunately, but that's what he's 3.
Yeah.
We're hitting that. And I think there's some other factors that are playing into it as well as just being a 3-year-old. So we're getting some extra help there, but it's not good timing.
But you know what I love is I do love your transparency where you say we're in the middle of it right now.
Yeah.
And I think, just for people listening, like you're in the rut of it, but yet you still have such passion for it and you still have so much love and know that this is needed for the community. And so you trudge along and you find those good spots and you reflect on where have you came from. And, this may be hard, but this hard is better than the hard that I had when I was working for somebody else.
Yes.
And, that grit of not only your marriage, but then, being each other's kind of leaning spot in your family and the community. And I just hope that, I don't know how I can inspire you, but like keep going because it's really cool to see your guys' passion and you can feel your passion for what our community needs. But nothing worthwhile comes easy, right?
Ugh, yeah. Yeah.
It does not come easy. And
Yeah.
we are passionate. We're passionate about taking care of our kids.
Yeah.
And
I
learning
think
how to
that's
do
why
that
It's been so
and-
hard is we care a lot about doing good by them. And so
Yeah.
it just weighs heavy on us to do the best we can. And sometimes you just don't know what to do. Any parents listening can, I'm sure, relate.
Yeah.
So.
Yeah, and it's hard. And we're both by nature very transparent.
Yeah.
Perhaps an oversharer is what I would call myself
Yep.
because I feel like I don't like having small talk.
Yeah.
I like to get to know someone. And if they only want to have small talk, I lose a lot of interest because I want to get to know people and know them on a deeper level because there's so much we can do to lift each other up. And that's been something I've been so passionate about with this project is giving something to the community, to my patients that I believe in so much. And I'm so passionate about. And it's been challenging too. It has its own challenges because we're doing things very different. Our method of payment is what a lot of people get hung up on. And it's really hard to help people past that and to see, look, I am completely transparent, completely honest. I'm not going to take your money and run. Like, we're creating something that's very different. And from a business perspective, yeah, it looks a lot different than what you're used to. But I promise you, this is a better way. And it's the most up-to-date way. And I hope that every other, dental professional will follow. But I'm passionate and unapologetic because I was so tired of what dentistry looked like. But in reality, it's such an exciting time to be in the dental profession. And there's so much we can do for our patients now to fix their problems and to treat them wholly and provide them with some really incredible outcomes that weren't possible years ago.
Yeah. Well, and I definitely give you props because being the one forging a new path is even harder than kind of following, right? Like you hope that the next person that can follow it can be a little bit easier and you can guide them and you can lead them in those directions. But that doesn't, dismiss how hard it has been for you. And I give you a lot of credit for that forging forward and that grit and kind of being that leader in the new industry of how you want things to go. Before we kind of wrap up, is there something that you want to say before we do wrap up or any leading comments in the oral industry and our topic?
Yeah, well, this went by fast.
It did
Don't
go by fast.
Give her a little brief thing on the eggs because
Oh,
this
yeah,
is
we didn't go back to the eggs. So go watch our Instagram. An egg is a dome shape, and you have two compression domes that are together. So you take an egg in your hand and put the pointy part of the egg on each palm. Go home and do this. Try to break it. You won't be able to break it. But if you if you squeeze the nice round ends that are in the middle between the 2 points, where you crack an egg on a bowl is really easy. But because when you put the force into the domes on either end, that force is distributed like an arch. And so it's incredibly strong. So on that video, I squeeze one between my hands and you can see my hand shaking because I'm pushing so hard and it doesn't break.
Whoa.
And then another video, I step on a carton of eggs as well. And they don't break. And so I've become a tooth nerd. So this will be kind of the final thing of getting into like
The weeds.
the weeds, like the procedures you asked about. What am I most excited about offering? It's dentistry that imitates nature. Gone are the days of putting materials in tooth that are placeholders and that this is the best we have kind of scenario. We now have materials to replace missing tooth structure with material that behaves the same way. If you cut a hole in a dome and then load it, it's going to fail a lot sooner because now you've removed a really key part of that structure. It's like taking a cheap plastic bucket, that you buy from Walmart, and if you turn it upside down, stand on it, and it flexes, and you're like, oh boy, this is going to break. But it doesn't. It's because of that dome shape. But if you got a hole in the top and then step on it, it's just going to collapse. So teeth are compression domes. And if you cut a hole in that and then fill it with a material that doesn't behave like tooth structure, it's going to fail sooner. You're going to have more issues down the road. You're going to invest more money into that tooth long term.
And just it wreaks havoc on the rest of the tooth.
Yeah, it introduces stress fractures. It introduces other problems. And sure, that's not 100% true. It doesn't happen to every tooth. But biomimetics is approaching dentistry in a way that imitates biology so that when we do need to do a filling, when we do need to cover more of the tooth, say with the crown or something called an onlay, we can put a material on it that's going to improve the success rate and the long-term life of the tooth, as opposed to what was done in the past.
Interesting. So what is that material? If it's like the body, like what is it?
So it is resin composite polymers. But what is unique is it uses a lot of chemistry to then create an artificial bond to the tooth that's chemical and mechanical on a microscopic level. And so it starts to imitate. I mean, teeth are amazing. When you get into the mechanical properties of teeth, they are fascinating. And how all the tissue is fixed together. I mean, a fun fact, enamel is more brittle than glass, but is stronger than steel.
Whoa.
So when you take an enamel little crystal independently and load it, it breaks like glass. But if you take the whole enamel structure at large, which is this complicated pattern of crystals, it's stronger than steel. So these materials, just to kind of shorten this explanation, the materials, what's so important about them is they need to behave like enamel. They need to behave like dentin, which is the softer tooth structure underneath enamel. And so that's the key to it. We can use materials now that we can replace each of those individual tissues with a material that flexes, because teeth flex, they move, they compress, they flex, they're elastic. They're not static structures. And so now we can put material in them in a much more conservative way too, because of modern chemistry. And then that material allows that tooth to function the same way again, instead of functioning in a lesser way, in the sense of you take something hard, you put something soft into it, now it's going to flex in the wrong way, or you take something soft and put something hard in it, now it's going to cause the softer structure to fail. But now things can work in harmony, and that's 21st century modern dentistry that's super exciting, but it's taking a long time to distill down to the masses.
Wow.
Can you tell he's a tooth nerd?
You can, but I'm also very intrigued.
Oh,
like
good.
I'm not one, I'm not one of those people like, wow, teeth are super interesting, but just the way you explain it, and I think your passion behind it, I'm like, whoa, it's also making sense. It's also making sense of why you want a material that is like the material you're bonding it to, because if it's not, then it's not going to work.
Exactly. And there's a certain technique, because it's chemistry, you have to respect the technique that was designed to make it successful. And this is always hard for me, because I don't want to sound like I'm harping on other dental professionals, because I don't view anybody as my competition. They're all colleagues. What I'm harping on is the fact that the scientific community, the educational community at large has failed us.
Yeah.
I graduated from dental school 3 years ago almost, and I was not being taught any of this information. I've had to invest tens of thousands of dollars to learn the best way of doing dentistry because what I learned in dental school was not up to date and good enough.
Yeah.
And that's the problem with so much of the dental. People don't know if they're not digging into the research and finding these newer modalities. You just don't know what you don't know.
Yeah.
So.
And I think what really clicks in my mind right now while you say that is in so many industries, whether it be the dental, whether it be the medical, it's, well, it's the way we've always done it.
Mm-hmm.
That phrase right there across any human being is how you stay stagnant. And that is how you don't, fail forward, or how you don't make that momentum move in a positive direction. Well, it's the way we've always done it. Like, that phrase crawls underneath my skin, and it's just not right. And I think that is something that you can see, within the dental industry is happening as well.
Yeah, I mean, the birth world's that's a whole separate podcast.
Yeah, and parenting. I'm thinking about that fail forward and trying to,
there are
change the way we've always
much
done it.
newer, better, more scientific ways of doing things now, but we just...
Takes us a while.
Yeah, it takes a while to adapt. So
change is hard.
Change is hard, but it's the most inevitable thing to happen in our lives. If we're changing positively, if we're changing negatively, even if you have the right plan, guess what? It's going to change. And that's what life is. Life is there to change. And if you're not changing then it's changing around you. And so, I mean, that could be a whole nother podcast, right? It's all about change.
Oh yeah.
Within there. Well, as our time runs out, I want people to be able to know how they can connect with you. How can they get into your office? How can they learn more about it? How can they find you on social media? How can they learn from you guys?
Yeah, so you can look us up on social media. It's Restoration Dentistry.
It's at Restoration.Dentistry.
That's right.
Yeah,
Thank
there's
you.
the social girl.
Yes, and then you can find us on Google. We're in South Meridian, and we're the only practice named Restoration Dentistry in all of Idaho. So you can't miss us. Just make sure it's not in another state.
Perfect.
And check out our Instagram. There's a lot of things. I feel like I've rambled a lot, but there's lots of things that I haven't touched on here that we haven't touched on that we're passionate about. And so
we have more coming. We have some exciting videos coming up with some of the technology.
We have a lot of fun stuff coming in. And I just want to say one last thing about the art.
Yeah.
Teeth are incredibly beautiful structures in the way they reflect light and their natural characteristics. When I look at them under magnifying glasses and under using a very nice, highly detailed digital camera to be able to look up at a close-up, tooth structure is just incredibly complex. And the last thing I want to leave with is it's so wonderful that we finally have the materials to imitate nature.
Yeah.
That imitates the way the opalescence of the enamel and the fluorescence and the different color gradients and textures. So that's something exciting that in the past, we replaced tooth structure with just something that worked, gold or silver or sorts of porcelains. But now we can actually replace tooth structure with material that actually looks like tooth structure. So that if you need a veneer on one tooth because you broke it in half, you can actually have something that looks like your natural tooth, and not have to get a bunch of veneers so that they all look nice and white and homogeneous. Like, dentistry should never have to look like dentistry ever again. It should be able to look like just natural teeth, which is fun.
Gets you all excited.
I was gonna say you definitely love and I don't know if maybe it's because you're dentists, but both of you have beautiful teeth too.
Thank you.
Thank you. Thank you.
Your structures and the way that it's looking. So anybody that's actually listening to this podcast, I definitely encourage you to go check out their social media. That's how we were able to connect. Definitely just the power within, you guys have talked about the Instagram, like use it to a positive advantage for you and being able
Absolutely.
to connect and being able to, like, don't be afraid to reach out to the people that, maybe you want to come onto the podcast or going into your practice, or learning more from you. Like, the listeners, I encourage you to be able to reach out, because that's how we get connected, and that's how we learn from each other is telling our stories. So I appreciate you both coming on to the podcast. Any listeners, I also encourage you'll be able to find all of their contact information on my website, rawthoughtspodcast.com. So head over there, make sure you can reach out to them. And I would love for you guys, any listeners, to go and take a look at your office and your Instagram and be able to connect with you and kind of help you change the world of dentistry. So
Thank you.
I appreciate it.
You're welcome. And don't feel like you have to make a formal appointment too. Just come
Come
stop
by.
in if you want to
Yay.
meet with me for a couple minutes. We'd love to show you.
Yay. Awesome. Well, listeners and viewers, I appreciate you coming on and listening to another story. And you guys really are kind of my passion that is filling me, just like it is with Dr. Clayton.
Yes.
That's your first name, last name.
name.
There you go.
Clayton. I have two first names
It's
/ two
hard.
last names.
It's hard sometimes. Anyways, I just really appreciate you. So with that, further ado, I will let you go, and we will hear from you with another episode next week. Thank you guys. Bye. Thank you again for listening to another episode of Raw Thoughts Podcast. I'd appreciate it if you could follow, like, subscribe, and share with anybody that you think would be interested in this. You could also head over to my website at rawthoughtspodcast.com and see any other guests that have been on the episodes. You could also go over to Instagram and follow at rawthoughts.podcast. I would really appreciate it, and always send me a message if you're interested in being a guest or any feedback.